These are the three problems that we see with the AirFit N20 ResMed Nasal Mask. So the first problem that we've noticed with the N20 is on these patients are sometimes the clinician is guessing what size mask would work the best for the patient. The true way to do that is we have a measuring tool that comes in the bag for the mask, and what we would like to do is within the flanges we kind of look at the different size of this. Would be a medium, and we can see that the nares, there's quite a bit of room there. Large is excessively big, so the ideal fit for this patient would be a small size N20 AirFit ResMed Nasal Mask for this particular patient. So we've identified the first common mistake is measuring. So what we do, we have our trusty measuring tool here from ResMed. We're going to check Lindsay here, and she is in between there perfectly for small. So what we're going to do is we're going to get a small mask for her, and then we're going to show you how to apply that mask to her face. So we've identified that Lindsay is indeed a small size nasal mask. We're going to go ahead and apply this mask to Lindsay. We're going to put it right on her nose there, and then we're going to come around and put her headgear on, and we're going to tighten the top nice and tight where we have, and then the bottom. And Lindsay, make sure that we have the right size headgear and mask. All right, and we've got it on there, and it does it right on the top of her lip, and it's not too far up above her bridge is the correct placement. We go ahead and attach the little extra elbow arm, and then we send some pressure through and see how Lindsay does. So we've fit Lindsay with the N20 AirFit by ResMed mask. And what we're going to do now is our second issue is sometimes patients are mouth breathers and might be aware of it. Lindsay, go ahead and tip your head back and pretend like you're sleeping here. And all of a sudden, sometimes patients aren't aware of it, but Lindsay's mouth comes open. And we have a big leak out of the mouth. It startles the patient. She's woke back up. Therapy is going to be very difficult for these patients if we don't treat that mask leak. So now we've identified problem 1, 2. The third problem is sometimes patients may be doing fine a part of the year, and then they call and noticed a lot of leaks or just uncomfortable wearing it. And what it turns out to be is a lot of people have seasonal allergies. Some time of the year when the pollen or the tree leaves, grass leaves really flare up. Sometimes that causes a lot of inflammation in the nasal passage, and the mouth comes open. And when the mouth comes open, therapy will not be as effective because a lot of the pressure is going out into the airway, not into the lungs. So a potential solution to problem 2 and 3 is just a simple chin strap. And the chin strap is just easily applied right underneath the chin, right to the crown of the head back here, and then it velcros. And what that is designed for is to keep that jaw from hinging open in the middle of the night. It doesn't take a lot of pressure to hinge it open, and it doesn't take a lot of pressure to keep it closed. But this would be an option to help these patients get full and effective therapy. So this is a potential solution to problem 2 and 3. If it continues to be problems through excess pressure or just uncomfortable, the third solution would be to switch to a full face mask. Again, remember that this is not medical advice. This is just educational information provided to you to get the best care you can from your machine and your mask.